Hi, I'm Jack Cush at ACR 2025, Chicago. Today, a presentation, a great poster, abstract LB, late breaking 15. The title of this had something to do with fiber and methotrexate. Did you take your fiber today? This is an interesting story. The idea behind fiber is that it's good for you, and maybe one of the ways it's good for you is it could change your microbiome. And maybe you follow the microbiome literature, maybe you don't, but there's some literature in there about the microbiome changing disease, sometimes by changing how drugs work. Either the metabolism of the drugs, or their absorption, or their effectiveness. And this applies to a lot of chemotherapies. It's been linked to methotrexate. So in this small pilot multinational study of 49 patients with mild to moderate rheumatoid arthritis, they looked at what happens when you give fiber to RA patients. Who are these 49 RA patients? Mild disease, generally about 5 to 7 tender joints, about 2 swollen joints. CRP median was 7 milligrams per liter. So again, mild to moderate disease. It's a 1-month study. Half the group got 12 grams of inulin, which is a source of a complex dietary fiber, or a sugar pill, and they looked at the outcomes 1 month later. It turns out that at 30 days, the ones who got fiber had, and again, they had mild disease to begin with, had greater achievement of EULAR good status, 57%, versus the placebo, 22%. They had a reduction in both Th17 cells in the periphery, as measured by flow cytometry, and the ratio of Th17 to Treg cells, and this was significant. And then lastly, for those who are on methotrexate, they had a significant drop in DAS score of -1 versus those that were on placebo, where their DAS didn't change very much. It was -0.38. Now, and again, the numbers here are too small to be significant. But when you look at the graphics on this, it looks like dietary fiber can augment methotrexate responses. They had a small control group of patients, but there were only 6 that were on other DMARDs, and it didn't look like fiber did anything for them. But they need to repeat this. It's a good pilot study. Dietary fiber could make methotrexate more effective. More from ACR.